An aneurysm is a weakening of a blood vessel. If the aneurysm ruptures, this can be a life-threatening emergency. There is an innovative, minimally invasive procedure to treat aneurysms before they become critical. Vascular surgeon Dr. Ali Azizzadeh at Cedar Sinai Medical Center in Los Angeles explains what an aneurysm is and the newest procedures to repair them.
An aneurysm is a bulge in a blood vessel. That's the basic definition. So blood vessels are conduits that take the blood from the heart to the rest of the body. Those are called arteries. And the wall of the blood vessel can weaken due to a number of different factors, and that becomes an aneurysm. You can get an aneurysm anywhere in the body that you have blood vessels running. Common areas of aneurysm formation are in the brain, in the main blood vessels that leave the heart, that's called the aorta, and all the blood vessels in the arms and legs, they can form aneurysms as well.
Dr. Azizzadeh lists possible risk factors of developing an aneurysm and who should get screened.
Some risk factors for aneurysm formation are hereditary, and you cannot change that. Other risk factors include smoking, high blood pressure, and elevated cholesterol. And we try to modify those risk factors for patients who are prone to aneurysm formation or who have an aneurysm. So the best way to diagnose aneurysms is to do an imaging study, most commonly a CT scan. A CT scan or MRI can show the blood vessels that are bulging or are aneurysmal. We try to screen patients who are at high risk of having aneurysms so we can detect them before they rupture. For example, Medicare has a free screening for patients who have ever smoked in their life to get an ultrasound of the belly to find aneurysms in the abdomen once they reach 65.
Screening at-risk patients is crucial to catch this condition.
An aneurysm is called a silent killer because you could have one and not know it. Although most aneurysms are asymptomatic, meaning that the patient doesn't know he or she has them, some of them can cause pain in the back or abdomen. Like aneurysms of the aorta in the chest can cause chest pain or back pain. Aneurysms of the aorta in the abdomen or belly can cause belly pain. So if someone has unexplained back or chest pain and they have some risk factors for aneurysm formation, including high blood pressure, cholesterol, or smoking, they should have a screening test. The larger an aneurysm gets, the more likely it can rupture. So if we screen for aneurysms, we can detect them and fix them before they rupture.
Dr. Azizzadeh discusses the newest procedure to fix aneurysms.
In the old days, we had to open a patient and fix the blood vessels by hand. We would basically replace the aneurysm with a fabric graft. But today, we have a newer way of fixing these aneurysms. We can fix them from the inside without ever opening the patient. This is called a minimally invasive aneurysm repair. We call it endovascular surgery because we go from the inside of the blood vessel to fix the aneurysm. So we basically take the blood vessel and reline it from the inside. The procedure to fix these aneurysms is very successful. We have reduced the chance of dying from an aneurysm to less than 2% with this minimally invasive technique.